So Medicare, again, to refresh, Part A is your inpatient hospital care. Part B is your doctor services. Part C is sort of combines A and B and says if you want to get it through a third party, through Medicare Advantage. And Part D is your drugs. Anything that is still not covered by Medicare, flat Medicare, is not going to be covered by any other Medicare program. So in a traditional fee-for-service, CMS gives the money from themselves to the provider. So the patient goes to the provider, and you guys are super used to this with billing, and pays 80% directly to the provider. So what patients and beneficiaries do for the other 20% is you can get another health insurance, which is called a Med Supp. The Med Supp is always going to be secondary to your MA or to your Medicare, but it will cover the other 20%. There's over 10 programs types of models that could be the 20%. And then a patient, which they may not always know this, actually has to cover another insurance to cover their Part B, their Part D, which is their meds. And if they don't have either a Med Supp, the other 20% is not going to be covered. In a Medicare Advantage, CMS gives 100% of the total cost of care, which is the benchmark, to the Medicare Advantage. And then the Medicare Advantage pays the providers, the difference being that what you have is a closed network. A closed network means that you can only see those doctors and you can't travel, right, because you're there. And so